Thank you very much, Mr. Chairman. It's a pleasure to be here this afternoon. Ranking Member Cummings, I appreciate your comments about our staff. Members of the committee, I'm very pleased to be here today to discuss our most recent report on ways to make government more efficient and effective. We've, in this report, highlighted 17 areas where we've focused on areas of fragmentation, overlap, or duplication in the Federal Government and made recommendations to address these issues. For example, from 2002 until most recently, the Department of Defense has moved from 2 camouflage ground-based uniforms to up to 7, so that they're service-based purchases rather than joint purchases, thereby foregoing the opportunity for tens of millions of dollars of savings, but also importantly from ensuring equivalent protection of service members during joint operations. We've made recommendations to address that issue. Also, in the Medicaid program, which is an area where there's a large amount of improper payments, billions of dollars a year, the Department of Health and Human Services, the CMS, has taken a number of actions. However, we pointed out one action where they actually hired 2 contractors for every state, one to review the data to decide which claims to audit, and another contractor to audit the claims. We said that's inefficient, duplicative, one contractor will do. Then also in the area of geospatial or mapping information, there are billions of dollars spent every year by the Federal Government to buy this information, and it's been well reported that there are duplicative investments. And so we've focused on recommendations to ensure more effective coordination of a joint committee that's focused on these activities. It needs to do a better job. OMB needs to have more visibility and to be able to prevent these duplicative investments, and it needs to become a priority. In this case, Mr. Cummings, they have a plan. It's not executed, Mr. Chairman, and it's not a priority. And it's got to be both, and thereby reaping benefits of millions of dollars in this area. Now, we also identify 14 other areas where there are opportunities for cost savings and revenue enhancements. In cost savings, we've testified before this committee on the Medicare demonstration pilot on Medicare Advantage and recommended the pilot be canceled. At the time we did that, there was possibility of saving $8.3 billion because this pilot only rewards average performing plans and is not really going to demonstrate what it's intended to demonstrate. Right now, there's still an opportunity to save $2 billion, but Congress has to act soon in order to cancel this pilot. Also, in the Medicaid area, there are billions of dollars spent in addition to reimbursements for claims in order to make sure that there's money provided for uncompensated care. We think there's not enough oversight over these areas, and there's costs being reimbursed that are well in excess of the costs that are spent to deliver those services. And this doesn't make sense. So there needs to be more transparency and accountability. We've made recommendations on the revenue side, for example. We've made a number of recommendations to the IRS in order to help close a $385 billion tax gap. There's also opportunities for the Congress to legislate in the tobacco tax area to make the tax equivalent for similar types of products. That could garner the Federal Government several hundred millions of dollars and up to a little over $1 billion a year and make that more equitable. Now, turning to our prior reports, if I could direct your attention to the chart here, this shows the percent of actions that have been taken on the 130 recommendations we've had already. 12%, as you mentioned, Mr. Chairman, 16 or 12% have been acted on. 66% have been, or 87 of them, we've had partial addressment, and 21% or 27 of those actions have not been addressed at all. So there's plenty of opportunities. And the opportunities are throughout government. I'll show my last chart. This is, for all 3 years, we've got 162 areas, 380 specific recommendations for action. They go across virtually every major department and agency of the Federal Government. Many of here are in defense, HHS, and Treasury, which are about 56% of total obligations for the year. So many opportunities, Mr. Chairman. I look forward to answering your questions today and working with this committee to make government more efficient and effective on behalf of the American people.